There's water bottles back there, and we'd like to have you use them. If you need water, please do so. And I want us to be out of here by 8:30, and by the number of people that are here, that's great. And our next event will probably have to be in a larger venue. I'll be having other meetings and organizing them, and invite all of you there. Other issues that we'll talk about will be immigration, illegal immigration, legal immigration, the deficit that we have in the state of California, which currently is that we're $25 billion short, and what have you. So let's get going. I'll time you, and when your time's up, please move on. So if you line up, maybe on whichever side, come on up, and we'll get you going. Who wants to be first?
I have enough time.
Thank you, ma'am. My name is Perry, and I've been living here in the Central Coast for half my adult life. Thank you very much for reminding us about the Declaration of Independence that declared that we were born with these rights of liberty. My opinion about the healthcare situation is, if some people don't like what the current policies are, the insurance policies, and they don't like all the other things, this is a free country. You can go create your own. Thank you very much.
My name is Susan. I've lived in Morro Bay since 1981. I'm gravely concerned. I'm concerned about the way that we've dialogued, and I hope this is a friendly, peaceful discussion tonight. I respect Matt's views. I don't agree with him, but I do respect his ability to speak here, as those who don't agree with me either. I am greatly concerned because I feel our country shows its priorities by how it takes care of its people. How we take care of them. And I'm not really talking about the government here, I'm talking about us. How do we take care of one another in this country? How do we make sure that the children are taken care of, that they're fed, that they have health care, that people of all ages, if they have a problem medically, they can go in and have help without it causing bankruptcy in the family. How people with pre-existing conditions can actually get help. For myself, I can't get a divorce until I get health insurance. I'm not alone. I'm in that age group waiting for Medicare so I can get a divorce. There are issues here where we have priorities and we're spending our money in places where I don't think we would all agree they need to go. I think that we need to take care of one another, that we need to have health care for everyone, that we need to take care of our children, the seniors, and everybody in between. And I believe that we have the will and the finances to do it. And we talk about the cost of doing it, and I say, what about the cost of not doing it? I actually support universal health care. If it's not doesn't make I'll take up the backup plan for now with a public option, but I would strongly encourage people to take a look at the priorities of this country and see where you want us spending our money. Thank you. Yay!
Thank you, sir. My name is Alice. How many of you people are on Medicare? How many of you are opposed to government intervention in health care that are on Medicare? How many of you would be willing to give up your Medicare? Yeah. Okay. 7 years ago, I was diagnosed with breast cancer. Got treated. Last year I got diagnosed again with breast cancer, a little more invasive this time. I was treated. I had surgery. I had radiation therapy. I will be monitored forever. I'm taking a hugely expensive drug. There is no way, without Medicare, I could have paid for this. There is no way with a pre-existing condition that I will be able to get health insurance. I had shoulder surgery. My husband has diabetes. There is no way on God's green earth that we will be able to afford our own health insurance without Medicare. I do believe that we have a responsibility, a moral responsibility to our fellow citizens to help them. There are people who cannot afford health care insurance, and this is exactly who the government option is designed for. It is not a requirement, it is an option. It is not, dear God, it is not socialism. I'm 67, so I'm on Medicare. I'm a retired teacher. I am very offended by how this started back when we were having the elections, how the classes were being pitted against each other, and we were being told, tax the rich, tax the rich. As a teacher, I should have said to those students, don't try to achieve and better your life, and if you're lucky and you become rich, well, the government's going to punish you for it. I feel people who are not in agreement.
So sorry for them.
For the people who are not in agreement with me, I believe in helping others, and I believe in helping others, and I believe for the people who are not in agreement with me, I believe we have been taxed plenty. There's plenty of money in the government. The Congress is out of control on both sides, and it's not just started with Bush. When Bush was in office, the Democrats were controlling Congress. So let's stop blaming each other. We need to get Congress to start working for us and not for their own glory to be able to run the country.
I'm Bill, lived in Cambria, have for 15 or 20 years. Most of us, whether we're on Medicare or other private care, are happy with the coverage that we have. Most of us also know that the cost of this Medicare has risen astronomically, and we should do something about it. But because of these costs are so elevated, there is no reason to tear down the system that we have and replace it with socialized medicine. There's some things that we can do and not tear down the system. One is we recognize that there are some people, the rules say that you have to put, well, maybe you're dissenting, yes. We recognize that there's some people that aren't covered, and my position is that we can cover those people without tearing down the rest of our coverage. Now, one important point. The other is to allow the insurance companies to compete with each other across state lines. If we do those two things, we won't have to take $500 billion from Medicare, take $200 billion from hospitals, add 47 million people, 20 million illegal, to the system. We won't have to add $1 trillion to the deficit. Thank you very much.